Hi, I'm Hannah Causseaux, and we are going to discuss infantile colic. If you have ever had a child, you might be familiar with the term colic. And even as I said that, some of your minds immediately went back to those long days where the baby would cry for hours at a time with no apparent reason. Infantile colic can be easily remembered by a simple rule of threes: crying for no apparent reason, lasting at least 3 hours per day, occurring at least 3 days per week, in an otherwise healthy infant less than 3 months old. Colic involves that excessive, turbulent, high-pitched crying with an unpredictable onset, but it is benign and self-limiting. It usually peaks when the baby is around 6 weeks old and resolves spontaneously around 3 to 4 months. The incidence of colic appears equal among male versus female patients, breastfed versus formula-fed infants, and full-term versus preterm babies. The specific etiology of colic is unknown. However, there are some GI, biologic, and psychosocial causes that have been proposed. Some think that colic is a GI disturbance like faulty feeding techniques, cow's milk allergies, lactose intolerance, or GI immaturity. Biologic causes can include things like increased serotonin, cigarette smoke exposure, or maternal caffeine intake. And psychosocial causes tend to focus on the baby's temperament, overstimulation, and parental variables like family stress or maternal depression. So as nurse practitioners, what do we need to know? First and foremost, we need to know, when does the crying occur and how long does it last? This helps to determine if the crying could be associated with GERD or swallowing air, and the duration of crying helps to differentiate normal crying from colic. Secondly, we want to know, what are the baby's feeding, stooling, urinating, and sleeping patterns, and this includes any vomiting. This helps to evaluate and rule out the possibility of any GI, GU, cardiac, or metabolic conditions like reflux, infection, constipation, or even a testicular torsion in males. And finally, we want to know, what do you do when the baby cries? And this answer can provide information about soothing techniques that are helpful, not helpful, may exacerbate crying, or even be harmful, like shaking the baby. When it comes to assessment, diagnosis is based on the history and physical, so a thorough physical exam is of utmost importance. And first and foremost, physiologic causes must be ruled out, period. So number one, we want to assess the hydration status and subcutaneous fat. And these assessments are going to help evaluate the adequacy of feeding. This includes checking the baby's skin turgor, assessing for tongue tie, which can be associated with poor breastfeeding. And we want to make sure the fontanelles are not sunken and the baby should have tears when he or she is crying. Next, we want to evaluate the abdomen for any tenseness, tenderness, or absence of bowel sounds. And these can all be possible clues to any kind of acute abdominal process. The abdomen should be soft and non-tender with normal bowel sounds, no distension. However, you may see mild distension or frequent flatus, which can indicate ingestion of air while the baby is crying. And finally, we would want to assess the skin and musculoskeletal system for signs of infection or trauma. And be sure to check for signs of abuse, pain with movement, rashes, and do not forget about hair tourniquets. As far as treatment goes, unfortunately, no pharmacologic treatments are currently recommended for colic. While simethicone or Mylicon drops, PPIs, and probiotics are commonly used, evidence just does not support their effectiveness at this time. Anticholinergic medications like Bentyl have been proven to be effective. However, because of the serious side effects like apnea, they are not recommended. Management of colic is therefore targeted at parental support. So first-line interventions consist of addressing feeding problems and suggesting techniques to soothe the baby and decrease any environmental stimuli. We want to educate parents about normal crying behaviors and potential soothing measures, and just remind parents that babies cry. First of all, always check to make sure the baby is fed, dry, and warm. Then practice soothing measures such as rocking the infant, using a pacifier, swaddling the baby, frequently burping. Number two, we want to reinforce proper feeding techniques to decrease air ingestion, which can lead to gas and then a fussy baby. Bottle feed the baby in a vertical position, and even consider changing formula if that needs to be done. And finally, offer parental support. Reassure the parents that the infant is not sick, the infant is not rejecting them as a parent, and that it is okay to have a rescue plan and ask for help.